Welcome everyone to this ZUPA webinar. So today we're going to share the unique insights gathered on the care sector from our recent independent research audit. Just a quick introduction, I'm Ollie Brand, I'm the CEO and co-founder here at ZUPA, and today we're joined by our very own Mark McCarthy, who's the CFO here at ZUPA and former Managing Director at Sanctuary Care. Now, the big question that we're looking to address today, as you can see on screen, is can technology create smarter ways of working? This is very relevant, especially with the growing need for operational efficiencies as businesses are currently being hit with resource constraints, inflationary struggles. I mean, we'll get into the many challenges shortly, but we've got some compelling findings to share. Just a quick bit of housekeeping. We'll be sharing research today, so there'll be a lot of detail, but the recording will be shared afterwards, so don't worry if you miss anything. Just sit back, relax and enjoy. And also questions, fire your questions in throughout. We're using Microsoft Teams, so use the live Q&A tool that's in the top right-hand corner. Send your questions in throughout and challenge Mark and I, and we'll get into the questions at the end. Now just a quick look at the agenda. So our agenda for today is, first off, who we are. We'll keep it very brief. And then before we take a deep dive into our findings, we're going to address some of the macro challenges that are impacting the care sector to set the scene. We'll then move on to the outputs and findings, touching on the knock-on effect of some of the challenges, what people would do given more time, something we feel challenges the status quo, which we'll reveal shortly. And then Mark will take us through the actionable insight we've identified as a result of this, and then we'll summarise it and open up for questions. So all in all, it should be about 40 minutes. I'll be the meeting police, the time police, and make sure we run to time. But first off, just a little bit about ZUPA. So we're a UK-based technology company. Our heritage, we were born 14 years ago out of the IT department of a contract catering business that's focused on the care and education sectors, and we've evolved to focus on any organisation with catering operations opening up to the wider hospitality sector. Our purpose is to simplify business and enable people to thrive at work. And that's said in the way that care staff didn't join the care sector to be chasing their tails through mountains of paperwork. And likewise, chefs didn't join to sit on their phone and do stock takes all day. And that's said in the way that, you know, we look to automate these day-to-day tasks, ironically spending less time on our product because it automates it so that they are freed up to do what they do best. Our vision is to create sustainable business where people spend less time doing mundane tasks and are freed up to do what they love. Now, when we say sustainable, that means both in terms of financial and environmental impact. And that's something we do internally. We live and breathe it, and then do it externally as a business, which is fulfilled through our product, CaterNet. Now, CaterNet is our best-in-class catering management platform, which covers supplier management, e-procurement, also known as procure to pay, stock, recipe, and menu management. Now, naturally, with what we do, we're intrigued to review what is happening in care and the other sectors that we work in, to challenge and provide support to help the sector and those working within it, which gets us into the care sector today. So it's been labelled as the perfect storm of problems. We've had Brexit. Even before the pandemic, this has led to several downstream impacts. We've had staff shortages. This is potentially the biggest one, a shortage of talent in the sector causing the worst staffing crisis in 20 years. COVID-19, I don't need to talk about the challenges that the pandemic brought, but then national inequalities relating to social, financial and health status. Inflation, the pressure that each care home experiences as the cost of supplies becomes unsustainable, only to pinch the homes and their residents. And then funding, with local authorities not covering the cost of care and looking at private avenues. So these challenges are all interrelated, but it doesn't negate from the fact that there are new challenges every day. And it feels like the sector is overlooked with a lack of investment, including in technology. Now, with technology in mind, there's been a reasonable response to the front office technical systems, such as communication tools like Zoom, Teams and FaceTime, enabling remote care plan meetings when face-to-face meetings were banned. But where there's an apparent oversight is in the more fundamental back office systems, such as patient records, electronic care plans, staff rota management, e-procurement and financial systems that ensure efficiency in day-to-day inner workings of the care sector. And from our experience and our own research, there seems to be a gap with this. Yet it's something that's been spoken about for over a decade, with quotes, as you can see on screen, from the likes of Dr. Dave Howe and Paul Burstow being cited up to a decade ago. So now, considering the perfect storm of challenges and our very purpose to simplify business and enable people to thrive at work, we had to pull the thread to find out more, which gives you a better understanding of why we did this audit. Now, just a quick bit of background on the study. We surveyed 330 care home professionals, and we set out to explore the views towards technology and the use of technology in the context of the multiple challenges that care home professionals are facing in their daily working lives. Also, to understand the current attitude in the sector, whilst looking to identify any patterns that would help move the sector forwards to solve operational inefficiencies and deliver on our purpose and vision. So in summary, there were three clear themes to our research. The first theme is challenges are leading to various impacts, unwillingly outside of the individual's control, who have ideas on what they're looking to improve, which highlights the strength and passion of those in the sector. Theme number two is with conflicting challenges, impacts and ideas, this is leading to a vicious cycle, care, staffing and process disconnect with a desire for automation, ultimately to free up time to focus on what they do best. And then the third theme is conflicting view of technology and the potential role technology has to enable improvements within the care provision. So saying that the attitude and the appetite is there, but there's still resistance, which will tee Mark up nicely. So we're going to explore each of these sequentially and take you through our findings. So theme one. So looking at some of the big challenges being felt. So the first one, lack of staffing and resource. 67% are feeling the pain of this, which feels expected considering the perfect storm. Rising costs, with 41% feeling the squeeze, needing to keep an eye on pricing and margins. Nutrition and hydration, 32% are feeling this, needing to check labels and accommodate for things like dyslaggia and record fluid intake and outflow. Running out of supplies, 30% feel this, but this isn't only in the care sector. Supply chain fragilities are having a knock-on effect everywhere. It's being felt in every sector, but it is especially concerning for those looking after the vulnerable. And then managing risk, 29%. So the worry that outdated process could cause a risk to resident safety. And all of this is having an emotional impact being felt on the ground. 63% are feeling stressed and subject to burnout. 50% are struggling to fill roles, as there's a shortage of talent and difficulty with retention, making the next point very relevant. 49% say these lead to staff turnover, which then has a ripple effect in any business. All of the above contributing to the vicious cycle I'll share with you shortly. But in addition to the emotional impact, there's an operational impact. So looking at what is getting sidelined due to the reactive nature of the care sector. The big one is staff happiness. 54% have identified this as an issue when managers can't focus on their own teams. Productivity, 44%. So not allowing people to do their best at their day-to-day. Resident care quality, 39% are feeling this. Arguably the highest priority item here from a commercial perspective, and not being able to fulfill this would be incredibly frustrating. Catering for dietary and nutritional needs, 27% are struggling with this, whilst it becomes more of a focal point in regulations. Stock management, 22% are feeling the frustrations and lack of focus on this, leading to sunk cost and wastage. And then reporting, 19% are not getting the space to do this, when there should be a focus on reading and analysing data as opposed to capturing it, and teams should be taking this information and shaping behaviours to help make informed decisions. So all of the above highlights what is being sidelined due to a lack of time. So we decided to look at the opportunity cost of this time and where people would focus their efforts. So when respondents were posed with the question, what would you do with more time? 56% would improve the quality of resident care to focus on what they do best. 50% would improve staff satisfaction. 50% would be more creative with resident social events to provide that value-added experience. 42% would spend more time on individual care planning, making sure there are robust care plans for each resident. And then 20% would focus on reporting and compliance preparation to reduce the pain around inspections. And finally, 20% would implement new technology to improve processes. Now, this last one is an interesting one because when we look at it in more detail, outside of the perfect storm, we've identified process to be the biggest controllable cause of a lack of time. So that rhetorical question, are you only as strong as your weakest process? Well, when asking about process, these are the most resounding responses. Only 4% of care home professionals surveyed say they don't have outdated or manual processes. And 86% admit that the biggest thing that sidelines day-to-day activity is time-consuming and outdated process. So this is highlighting that the reactive problems are stopping people from being able to understand, evolve and automate process. However, people don't see updating technology as a priority if they have more time. As you'll recall, only 20% said they would focus on this if they did. So we're going to explore the impact of poor process in more detail, which brings us to theme 2. So with conflicting challenges, impacts and ideas, this is leading to a vicious cycle: care, staffing and process disconnect with a desire for automation. So starting off with that statistic in the middle there, 86% say things are getting sidelined due to outdated process. So we put that at the top. Outdated and manual process leads to unnecessary time spent doing manual tasks. This then has a knock-on effect to stress, naturally going to expose and stretch people, possibly lead to burnout. That has a knock-on impact to a poorer level of care due to the lack of time, added stress, quality and productivity is damaged. Then it has a knock-on effect to job satisfaction. People don't get into care to focus on admin. They end up doing this, getting stressed and not doing what they do best. That has an impact on recruitment and retention. Naturally, there's a feeling of resentment, increases attrition of people and builds a struggle to attract new people. And then a knock on to staff burden and challenges, especially for the managers with care home inspections, the perfect storm of challenges weighing them down, and then full circle, the inability to address the outdated and manual process. So we wanted to better understand what could alleviate this cycle. Business process automation, which equals new technology to align to or evolve your process, is the modern way of work to automate the admin tasks so people can be more productive and do what they do best. When analysing what those who, given more time, would prioritise new technology feel would benefit the most as a result of this, these are 62% say staff happiness and get more fulfilment, 57% say productivity of staff, and 54% say resident care quality. So this would break the chain of the vicious cycle. There's a clear view that if there's an assertive push to focus on back office process and automating it with new technology, by putting the team first and improving their attitude, leading to better retention, there'll be a downstream impact on being more productive and increasing the quality of care, ultimately benefiting the residents. So happy team, happy service, happy residents. So what's stopping us from making these changes? This brings us to our final theme. So the conflicting view of technology and the potential role technology has to enable improvements within the care provision. So there's mixed feelings. The biggest challenge when implementing technology in business is collective buy-in, as it is a collective purchasing decision. And there are a range of attitudes towards this. At a high level, the appetite for change is there. 2/3 agree new tech would ease the running of their care home. However, the main friction comes from bandwidth for training. There's a 50-50 split on the cost benefit of introducing systems in terms of productivity, with it being too difficult to train staff. Cost, 45% feel that it would be too expensive. Expertise, 38% feel they don't have the expertise in-house to introduce new tech. And culture, 18% feel it wouldn't agree with their culture. Which brings us to our next point: how can technology help? Well, in summary, it will reduce admin and free up time, and when time is money in care, with 62% agreeing it will reduce admin burdens. This is a hard financial savings, but that doesn't consider the knock-on hidden cost savings in increased productivity and engagement, reduction in recruitment costs or lower staff turnover, improved service, and therefore resident retention. So as you can see, there's an immediate benefit and then an underlying knock-on effect to help the people on the ground and the wider business. But that concludes presenting the research, which I hope has provided some good insight and perspective. With the question, how can technology help? Mark has been on the ground with care and has got the experience to share, which rhymes. So with that, I'll pass it over to Mark.
Good afternoon, Ollie, and thanks for that useful insight. So is technology a solution for the care sector? In my opinion, I believe it absolutely is. In the next 5 to 10 minutes, I'll set out a case for why I believe this. We'll start with change. As with any change, there is a potential blocker to the introduction of technology, the most common barrier being the perception of cost. As previously introducing technology or a new system came with a significant upfront capital outlay. That has changed with the introduction of cloud-based tech, as this means you effectively pay as you grow and pay as you go via a license fee or a percentage of spend, for example. There is also a reluctance or a perceived lack of time to enable change, or thinking that tech is hard to use. There may also be an element of distrust in the use of tech, as it does create a central view of what is being done, by who and where. Then, of course, there's the issue that making the change can be difficult, especially if thinking that the way you've always done things is the safest and best way. However, many of these issues are not the case in my experience, and in most cases, especially if time is invested into training staff and choosing the right system, which is efficient and has intelligent process flows, tech will actually help improve the quality of service and care provided, as there will be more time for staff to provide care, to plan and to discuss the changing needs in care. I've also seen tech being used to help support a care home through its CQC inspection, so there are many advantages to be had. In fact, as Ollie said, our recent survey showed that 62% of care home professionals agreed that introducing new technology would ease the running of their care home. And remember, 86% said the quality of care can be affected due to outdated and manual processes. So before we look at tech, there is a bigger issue: staff retention and attraction. This is a major concern for the care providers across the UK, and Brexit and the pandemic have combined to give that real storm that Ollie was talking about real potency. Brexit has dramatically reduced the pool of staff that were previously available. Before Brexit, there were over 112,000 EU citizens working in the UK care sector. Many of these are no longer able to work in the UK, as care work is not categorised as skilled work. I have one word for this: really. So, is it a coincidence that today there's more than 100,000 staff vacancies across social care? I think I'll let you all ponder that one. Another interesting stat that links tech and staff recruitment is that 27% of the total workforce and 32% of managers are over the age of 55, meaning that there is time to modernise and embrace technology. So, is technology a solution to aid staff costs, to staffing issues? Yes, I believe it is, but it cannot be done alone. For example, the government could help ease recruitment worries by reclassifying social care work as a skilled job and increase the funding so care providers can pay more to their staff, as this would immediately improve the attraction of working in the sector, helping to improve retention issues for the sector too. However, Without technology, many workers may choose not to return to the sector, as it is a challenging and emotional place to work, which has mountains of important paperwork to complete accurately every day. The sector must believe the introduction of technology is a way forward, especially as workers of the future only know tech, and those who need care in the future are already embracing tech as part of their everyday lives. So, reclassifying social care as a skilled job, introduce more technology, such as electronic care plans or an e-procurement system, and all of a sudden the care sector becomes a more attractive and rewarding place to work and build a career. As there will be more staff on the ground, there will be less staff burnout. Introducing more automation via tech will enable staff to work smarter, not harder. This will help everyone to improve the quality of service as paperwork is removed and processes are simplified. So, technology in action. As is limited time today, I'm only going to mention some of the benefits as I see them from electronic care plans and e-procurement systems that they can bring to care home providers. Resident care plans, wow, they are huge, with often over 100 pages long per resident. But there is good reason for this, as there is so much to know and understand about the person you're caring for to ensure they're able to live the best possible lives, young or old. However, how are a team of people going to know everything they need to know all of the time? I believe that with paper-based records, that is virtually impossible or extremely time-consuming. I say this as if one thing changes about a person that you're caring for, this change may need to be updated manually across the care plan, medication records, and informing the catering team that a resident has developed an allergy or their change in health needs means they can no longer have their favourite meal or snack, and so on. Introducing care plans can literally be a lifesaver, as once the record is changed, technology does its thing. As all relevant records and teams are updated seamlessly, a simple but important task is now updated in seconds, no longer in minutes or hours. The best part? The carer or nurse doesn't need to leave the room or the resident, as they can update the care plan with a handheld device, meaning they're able to engage with that resident for longer, the home management are more content, and everybody's more enriched. Let's use allergies for an example. A resident has or develops a certain allergy, which is recorded on the care plan. Now this information can be shared with the catering team immediately, so they're able to amend that recipe or menu to enable that resident to enjoy nutritious food, importantly, safely. How does that happen? Well, tech can be configured to communicate with other tech via a process called an API, which stands for Application Programming Application Programming Interface. In this case, the care plan is talking to the electronic e-procurement system, and bingo, the information is shared. So let's moving on to product and cost control and supply. Savings can be achieved via the use of an e-procurement system, but let's focus on food for now, as the food is an integral part of everybody's life and often the second biggest operational expense in a care home after staff costs. And every care provider would want to provide the best quality nutritional meals available. Some care providers today may be able to put their finger on a consistent ABL, an approved buy-in list, and a set of recipes. But are they fully in control of the quality of the products, their prices, and aware of allergens? I would doubt it. My reasoning is because most care providers cannot be certain that in control of such things, as there's no true way to control it via paper and without a centralised e-procurement system. There will be localised ways of doing things in every home, which will have their go-to products or their favourite supplier. This is almost certainly be the case in care providers that have grown, as they will have acquired single homes or groups of homes from other providers. So we'll have different ABLs, different prices, different menus, and in some cases different systems. All care providers would improve cost control, recipe planning, product quality, food service, whilst being fully aware of what they're buying, how much things cost, and how much stock the home has. They would also be able to record food wastage, which could be compared against occupancy, what allergens and nutritional values their menus contain, all controlled and possible if they had a good e-procurement system. These systems can also ensure that product lines reflect a desire to have balanced and nutritious menus. They can control the cost of products as ABLs are created and managed centrally, which can prevent product and price creep. E-procurement systems also have simple things like alerts and reporting, which inform local, regional and central management teams as issues arise, meaning that providers can quickly address issues efficiently. This can also help them reduce their carbon footprints, as operational staff will travel less due to the alerts and reporting highlighting where specific issues exist, opposed to having to travel to each home to find out what the cause of an issue may be, all helping to save time and money. So the takeaway. Today, technology is mainly cloud-based, meaning care providers can afford technology systems as there is no capital outlay up front, and the cost of the system is charged on a subscription basis, meaning that the system is paid for as it's used, based on the number of locations or a percentage of spend, for example. I believe that technology must be a part of the future in the care sector, so care providers should talk to tech providers as they will want to help provide solutions to the problems that care providers do face, helping them to save time and money, whilst often helping to improve the quality of service for all. And remember what I said earlier, tech is the norm for the workers and residents of the future. Put simply, in my opinion, the use of the right types of technology would help care providers to improve quality. It will help them to retain and recruit staff, as staff will be able to spend more time doing the thing that they enjoy the most, such as care staff providing the best possible care and the catering team serving appetising and nutritious food. Thanks for listening. I hope it was useful, and I'll now hand back over to Ollie.
Thanks, Mark. So I will now close off the session, which I'll go for a summary and then get into the questions. So to summarise, it's clear that care home professionals are having to deal with multiple challenges in their day-to-day working life. And this research explores what they deem as the contributing factors to these challenges. The salient points from the research are lack of staffing and resource is the main worry for care home professionals. Time-consuming and manual processes are the biggest controllable cause to wasted time. Quality of resident care could be improved if care home professionals are given time back in their day. And there is a willingness and desire to adopt new technology to help improve service levels, but still some resistance. But the thing that stands out is that those who work in the sector are motivated and passionate about what they do and just need to free up their time to thrive at what they do to the benefit of themselves and the wider business they work in. By solving process, this will break the vicious cycle. It will move care homes from being reactive to proactive, and it won't only deliver time and money savings, it will have a knock-on impact to have a happy team providing happy service to happy customers. Now with that, I'll open up to questions and we'll have a little look on the dashboard and see what we've got in there. So I can see we've got 3 questions so far. So send them in, we'll keep the questions open and we'll get into them. But the first question we've got is, so what can we do in our residential home to encourage colleagues to be more open to technology, from Frank? So thanks for your question, Frank. I think, well, with that, it would be, you'd start with the why and the purpose. So what is it that needs to improve? Look at the process that you're identifying, and then look to a provider who'll be able to state the case to the team and give a better understanding and also educate you on how that process can evolve. I think Mark might be well positioned actually to give a bit more detail to this, having done it himself at Sanctuary. Have you got anything to add, Mark?
I can just add a couple of quick things to that. Yeah, it goes along what you were suggesting there, Ollie. Suggest the benefits after highlighting the problem. Prove to your team with a demo or a pilot that this thing isn't something to be scared of, and you can compare your manual process, your existing process, to the new automated process and show everybody the benefits, with the key benefit being time saving and more time spent with residents.
Brilliant. Thanks, Mark. Hopefully that answers your question, Frank. If it hasn't, please send a message in. Next question, where do we start if we want to implement new technology? And that question is from Sandra. Thanks, Sandra. So first place, again, identify the issue and get into the detail of what you currently do. Then get the team together, who's impacted by, if you're looking to implement a new piece of technology or you've identified something you want to improve, look at who it impacts across the business, get them all together and kind of map it out. Centralize your problem areas, get your requirements, all of you come together, speak and speak out and share what it is that you really need to get out of whatever this improvement will be. Then research, once you've identified it, finding the right vendors, and there will always be people out there. Speak to them, get visibility, get a demo, challenge them, ask them questions, identify who you want to partner with, because you've got to make sure that the business aligns to your company values as well. And then through process of elimination, you define which company you want to go with and which system. And then when it comes to actually implementing it, as mentioned, it's a collective process, especially in business. Identify who the internal champions are, because there are those who are involved in the buying decision, and then it kind of once you implement the system, it's got to emanate out, and it's really important that onboarding process is successful for a complete uptake. We've actually got a PDF to share on this topic, which happy to share with you, Sandra, and it's available as well on the resources, which I'll share at the end of this session. Is there anything else to add to that, Mark?
Nope, not really. I think you covered everything there. The key thing is collaboration.
Brilliant. Thanks, Mark. So the last question we've got on the board at the moment is, how can process automation lead to better purchasing practices? And that's from Sally. So where to start? So automating purchasing, what that does is, first off, it gives you central control. So if you've got a decentralized organization and at each home, as an example, it'll give you that central control to manage all your suppliers. You'll have that visibility of all your products as well as their prices, and especially in this environment where prices are fluctuating, so you'll have that visibility and no one will be able to change prices without you being notified and approve. It'll speed up cash flow, so there'll be alignment between buyers and suppliers at a point of in the order receipt process to actually the invoice as well, so there'll be a match. There'll be less paperwork with invoices as well. It will all be digital. There'll be less paperwork with stock, so less stock sheets, as it will all be on devices and on tablets. And of course, regulatory information direct from suppliers is pretty key, and that coming through to the end customer with that linkage, as Mark mentioned in what he said. Mark, do you have anything else to add on that topic?
I think just a couple of things from a practical use. Once you've got your system in place, you can create order templates, which means that if you have repeat orders on a weekly basis or even daily basis, set them at once and they're there to be used in the future, saving a lot of time. Equally with recipes, if you've got a central bank of recipes, they can be created by your central hospitality team and then shared with every home. So you have consistent products, consistent recipes, ways of doing things, which will improve the quality of service and consistency across your estate. The other thing I'd add is that history tells us that by introducing such systems will save you time and money. It also, as a byproduct, improve quality.
Brilliant. Thank you for that, Mark, and hopefully that got your question, Sally. So with that, I can see we no more questions now. So all that's left to say is thank you for listening. As mentioned, we'll make the recording available to you all, as well as the report summary. If you have any further questions, don't hesitate to contact us. Our email addresses are on screen. You can also access all information on our care campaign page, which you can access at zupa.com/care sector, as you can see on screen. Otherwise, I hope you found this useful. Thank you for listening, and we hope to hear from you soon. Thank you.